Excellent. So now we are at our last section. There are actually two sections. And now I would like to talk about ageist assumptions, right? Those sort of things that we are making huge assumptions about, right? So, what is a common misconception about older adults? See if you can think of one, two, or three. Think about those misconceptions about older adults that also intersect with health and well-being. What do you think they are? See if you can jot them down and then figure out how many you got right. Ready? Often people think about smoking, drinking, and drugging as not happening with older adults. And that is completely not true. The proportion of older adults, like 65 and older, that use marijuana, and this is a little bit dated, it went up from 2015 to 2018 from 2.4 to 4.2%. And this is really not capturing the common use now among older adults that marijuana has been legalized. I would say that that number has probably tripled or quadrupled among older adults, especially older adults that might have difficulty getting assistance in terms of managing pain. It's also something that's very, very common among baby boomers. It was their drug of choice. Another thing that is common among boomers and vets is that they have among the two generational cohorts, which includes vets, boomers, Gen X, millennials, Gen Z, vets and boomers have the highest smoking rates of any generation. I think maybe vets outdid boomers, but it's really just phenomenal. And so you will often see a 100-year-old person. I know that my husband's from France, and we see a lot of people. His great aunt smokes all the time and drinks wine. She's still hanging in there. And then alcohol consumption. So alcohol is a little tricky because this is a legalized drug. And so we don't think of it as being a drug. But one study found that 2.5 million older adults and 21% of older hospital patients had alcohol-related problems. This is huge. And it's, if anything, I think was exacerbated by the COVID pandemic. And then finally, sources estimate that in 2020, that there will be about 1.4 million older adults struggling with substance use disorder. I know in Harlem, in terms of people living with HIV and aging with HIV, that there are still individuals who are positive that are injecting drugs. I know also there was one woman in our clinic who was still injecting drugs. The one thing that, and this is my sort of focus as an HIV researcher, is on sexual health and well-being. And when I started doing work around aging, I discovered that it was impossible to find images of older adults being intimate. Sure, you can find them holding hands, walking down the beach, or, in separate bathtubs, looking out at the horizon. But seldom do you actually see older adults getting busy. And that's why I really, really love this. I downloaded it, and I'm not sure if it even exists on the Red Bull website anymore, but this is a Red Bull advertisement. Oh, Christmas. I need to go back. Red Bull, by the way, is a horrible, horrible product. Thank you. Look at all the Red Bull cans.
The drink that gives you wings.
Love that. And I think that that is wonderful. So I hope you remember at the beginning of our conversation, I talked about the 4 M's. One of the 4 M's is what matters most. What matters in terms of care and treatment preferences, what matters to the family in terms of how to care for an older loved one. But what matters also includes what's important to the individual. And for older adults, sex is an essential part of life, of a relationship, and it adds so much to their quality of life. Sex is not just about physical or penetrative sex, guys. As you get older, it's often more about intimacy, but it can be about penetrative sex. Sex literally does wonderful things to your body, whether you're young or old. It can add years to your life. It can improve your mental health. It can alleviate stress and anxiety. And it, of course, like solidifies relationships. Sexuality is and its expression is significant for many older adults. In a national poll on healthy aging, the 2017 Let's Talk About Sex survey, these are some of the findings. So we know this, that sexual activity decreases as we get older. We know this. So among 65 to 70-year-olds, about 46% were sexually active. Among 71 to 75, 39, and with the older adults, about 25%. However, among those people who are sexually active, 65 reported interest in sex. Majority of it were expressed by men, but still 31% of women also reported an interest in sex. 30% extremely. Yes, I'm sorry, let me just explain sort of why this is different. Among those individuals who expressed like that they were extremely interested in sex, 50% were men and 12% were women. And you can also see how that number also reflects across the life course. 73% were satisfied with their sex life. We see that among those, women were more likely to be satisfied. Those with partners, that makes a lot of sense, were more satisfied than those without partners. And those with better health were more satisfied with their sex lives compared to those who are sick or infirmed. The benefits of sex, I mentioned some of the top 5, but also sex improves your immune system, gives you glowing skin. It helps you sleep at night. And it does actually help with aches and pains and has been found to help keep you mentally sharp. As we get older, there are barriers to intimacy. And about 50% of older adults have some type of sex-related problem. But only 38% of men and 22% of women have talked to their physicians about this. This is a huge missed opportunity to address these problems. And if you are a future physician or nurse or PA, please don't squander that opportunity to not ask, are you sexually active? Do you still want to be sexually active? These are important questions. Otherwise, you don't respect their dignity. Some of the common problems include just decreased libido, with men, erectile dysfunction. And sadly, because people are not asking about sexual health, they're also missing opportunities to help reduce sexually transmitted infections, including HIV. So, in a national study of sexually active and healthy heterosexuals, 93% of those reported inconsistent condom use. This is a problem when in the last 10 years, we've seen STIs among older adults double and triple. And most of this is due to generational norms that, the boomers, for example, they became sexually active just at the time that contraceptives became available for people not to think about, I have to be careful because I could get pregnant. And so there are generational norms that we believe are contributing to this rise in STIs among this particular generational cohort. This is a lovely video, and because I am sex positive, in Florida, and this is a little bit dated information, but nonetheless, it's still pertinent. In Florida, they discovered that about 70% of the senior residents were basically getting STIs. And in Florida, they developed this PSA to basically promote condom use. And so, and it's fun because it's also showing that older adults can get into the Kama Sutra poses. So I think that it does a lot to sort of normalize sex and dispel myths around what an aging body can do or not do.
I just sit right here.
Show you something. Party, yeah. Let's get this party started. Party, yeah. Let's get your body rocking. Party, yeah. Let's get your body moving. Party, yeah. Let's get it on. Party, yeah. Party, yeah.
It's only one way to do it. Use a condom. And there are issues sometimes with erectile dysfunction and condom use, and we recognize that, but there are ways to improve that.
I just sit right.
So in terms of HIV among older adults, in the National Health Interview Survey in 2012, they found from a sample of 1,200 individuals that only 27% had ever been tested for HIV. And of those who had been tested, the last time they were tested was over 5 years ago. And 53% said that that test had been suggested by a provider. That's a good thing. But almost 84% said that their chances of getting HIV was none. And that's a problem. So this is sort of showing sort of the curve in terms of new diagnoses of HIV among older adults. And this particular trend was absolutely ticking up. And we're really happy to see that it is now gone down again. But, a lot of this was around, for example, older women living with HIV, older women were particularly vulnerable because just because of our biology and our physiology, that we are just more vulnerable to becoming infected than men, especially around heterosexual contact. And this sort of also indicates that a lot of the new HIV infections were mostly with women through heterosexual contact and mostly through male to male sexual contact with men. So HIV is ageless. Get tested is something that we are really promoted. And I believe in New York State, there is no age limit to HIV testing, that all providers should be recommending HIV tests. When I first started at STAR, I remember we had two gentlemen who were in their 80s who were found to be both HIV positive and had AIDS. So they had a dual diagnosis. And unfortunately, they were both 80 and they unfortunately didn't believe it. And I think within 6 months, both of them were dead. So now, how to address ageism? We are at the end. So ageism can be combated through policy and laws, through educational activities, and through intergenerational interventions. There's also this model called the peace model that focuses on two contributing factors that will help reduce negative ageism. So you remember at the beginning, I jumped ahead. So education. We need to talk about ageism. We need to also include older adults talking about ageism to help squash internalized ageism. We need to focus on having more positive examples of older adults. And we need to have contact. Remember in the video when the young people came out, they just saw the images of the older adults, and then there was this live, vibrant person. Through contact, through getting to know an older adult is the best way to help people understand about their own ageist beliefs and to dispel those in terms of what older adults can do and cannot do, all right? Not all older adults are the sick and frail individuals that we see in the hospital setting. So we are seeing an overrepresentation of one segment of the older adult society. These two factors are really essential. And so the peace model, positive education about aging and contact experience. And I also just want to remind you about the negativity bias in terms of holding on to negative experiences. I had one bad experience and it just completely has made you think that all older adults like that are this way. So we need to really seek out opportunities, intentionally create and focus on trying to find or to have these positive events and experiences to counter effect these negative past experiences. So taking steps to reduce ageism in healthcare. This is a quote from this particular site. Because ageism in healthcare exists across all levels, combating it requires that we need to implement strategies that involve training of providers and other healthcare practitioners, reviving institutional policies and procedures. At the University Hospital of Brooklyn, or now downstate, we are trying to initiate an age-friendly program for the entire hospital, and I'm excited about that. And we need to address ageist attitudes among older adults and among everyone else. Just because we are a certain age doesn't limit us. Remember, when you stop, that's when you start to get old. Some of the challenges, especially for clinicians, is the fact that there's a lot in sort of the daily procedures or practices of medicine that are ageist and that will unfortunately put people into particular categories as opposed to seeing the individual holistically. And these are barriers. These are barriers, and it make it really difficult for providers to embrace changing the way in which they are treating their older adults. So think about the screening and diagnostic tests and treatments, and think about your patient, not just their age. And, institutionally, we are really trying to adopt an individualized person-centered treatment approach. We are actively trying to work to reconstruct ageist attitudes in elderly patients or older adults. This is not my text. And to acknowledge the need to eliminate ageism within clinical practice and identify ageist attitudes from our training to the delivery of care. These practices and attitudes, the standardized assessments, procedures, and processes, they need to be flexible across the the lifespan. So I want to thank you. Thank you so much. I realize some of my slides don't have, because I made them really big, don't have the citation, but here are all of my, my citations here. And I am, again, really grateful to be able to do this. I enjoy talking to people and sharing how wonderful working with older adults can be. Thank you.